We're back on Morning Line. It's our final segment this morning with Carol Ziegler with us from over at Vanderbilt. She's with Global Health and Family Institute, is it?
I'm with the Family Nurse Practitioner program.
Okay, and you're a nurse, yes. And climate hazards, as you know, you've been with us for the program, what we're talking about here. All right, there's all kinds of things we can do. We've kind of painted the picture of how things are getting worse. And it's not to say there aren't solutions. We talked about the idea of solar energy or trying to be more green in a lot of things you do. Health is important, personal health. Everyone wants to take care of themselves to a degree, but what do you mean by that?
So I think if we can all optimize our baseline health, we'll all do better,
health,
right?
No, but that's true for everything, but especially so. Are you saying ways to maybe better acclimate to severe weather? Is there a way to optimize your baseline health by kind of becoming more accustomed to hot weather?
There is data on people. So if you don't have air conditioning and your body sort of acclimates to that, assuming the temperatures are not extreme, at some point it doesn't matter how acclimated you are, right? But yes, you have more sort of internal fitness, so for sure.
Sit in a sauna longer.
If your doctor or your nurse practitioner approves it, yes.
I don't know if that works. But I mean, yeah, your optimal health. Another thing that I notice when we talk about the health and the climate change, for whatever reasons, I take allergy shots, I eat my bee honey and all this. Yes. I have allergies, they've gotten better, but I think the allergens in the environment are on an increase.
Absolutely.
And I think it's because things are blooming longer and more than ever before and in some ways for plants, this warmer temperature maybe is better suited for them. I don't know. In the big picture, I don't know that it's a great thing. But would you agree then?
Absolutely. I know if you're a hiker, the poison ivy in the last 10 years has gone, because poison ivy loves CO2 and it loves heat. So we are seeing increases in all these things for sure.
We have trees where the vines of poison ivy, I was stunned that it was poison ivy. I think of this thin vine going, and they get big. So poison ivy, all right, allergies are on an increase. You can take steps. So when you say your baseline health, just in general, take care of yourself.
Sure.
More,
so generally by eating healthy plant-based diets, right? Eating your vegetables, eating your greens, decreasing your intake of processed foods and soda, things like that.
What about organics? You see them and they cost a little bit more sometimes. I buy some things organic, some things I don't. What's your take on organics?
So I think organics is going to be based on your income level, right, and the cost. And there are some things you can choose that will decrease your exposure. But also one thing that's important to know is typically those farming methods are better for the environment. So we also want to take that into consideration, especially when it comes to like animal husbandry. So organic eggs, things like that are typically better for you and for the environment. And then for produce, anything that a pesticide would have touched the part that you're eating, especially root vegetables, berries, things like that, you want to buy organic. Okay. If you can, yeah.
And if you can't, wash them.
Absolutely.
Let's go to Judy. Judy, good morning. Hi, Judy.
Good morning.
Good morning.
Thank you for taking my call.
Sure.
I would like to touch on a base that I haven't heard her talk about, the increase of Lyme disease. And I would just like to know if she has any comments on that. I'm in stage 3 Lyme disease, and it's really sad that I had called Vanderbilt and they would not take me because I had no proof of what was wrong with me. And it's like, well, how are you supposed to know what is wrong with you until you do the testing? So shame on Vanderbilt for that, because I was born at Vanderbilt. And so I still have Lyme disease, and the climb is just incredible, the amount of people that are coming up with Lyme disease. And I was told by one of the representatives that we don't have the tick-borne disease here. Yes, we do.
Sure.
So I just want to know that comment on that.
Yeah, hey, can I ask you, what kind of symptoms do you have now at stage 3? What does that mean?
I am almost debilitated. I'm in bed all the time with severe joint pain, rashes all over my body, migraines. The list goes on and on.
Well, can they treat it? Are you not getting treated now for it, or is it just permanent damage now for you because it was too long coming?
Yes, I didn't get diagnosed for 2 years and 8 months, and the lady that we finally got into, an infectious disease doctor, and they did some testing. Well, I didn't get a call back about the results, so I called back and I made an appointment, and she says, "Oh, you have Lyme disease and chlamydia pneumonia." Okay, well, you never called and told me this, so
Yeah.
I wanted to be at Vanderbilt, but what they've done is gave me 28 days of intravenous.
Yeah.
But I felt good for a little while, but that was it. And
hey,
then
did
the
you
symptoms
do you
went
remember?
back on.
Do you remember when you got bit by the tick?
No,
Yeah.
I was in. I know when I got sick, and I was in Orlando, Florida.
Okay. Well, hang tight on that. All right. She brings up a point. I don't know. As a nurse, have you seen an increase in Lyme disease, which I feel very badly for her, just going what she's dealing with. But we already talked about ticks don't die as quickly in the winter now because it doesn't get cold enough.
Sure.
So I'm sure we're seeing more Lyme disease.
We are. We're also, people forget about Rocky Mountain spotted fever,
Yeah, I
which
was gonna
is
say
the
that
tick
too.
illness that's really common in Tennessee.
Which is worse, Lyme disease or Rocky Mountain?
So if Rocky Mountain spotted fever isn't caught, it's lethal.
Okay.
And so I think, they're both easily treated if they're caught early.
They both can be treated, and
Sure,
unfortunately,
absolutely.
maybe it took a while for her. But yeah, the ticks and fleas stuff is on the increase.
Sure.
Just all this stuff. Cold weather, having a cold snap's really important.
It is, for sure.
And Nashville gets warmer. We see less and less snow than ever before. All right, so we took her call on that with this. What else do we want to touch on as we wrap things up? The things to do maybe moving forward. We talked about trying to go green. What else can someone sitting at home deal with to make things better? Because
I think
we're going the wrong direction still.
we are. So personally, one thing that you can do is if you optimize your baseline health, so if you eat well, you exercise, you get good sleep, you manage your stress, which I know can be difficult, you'll have less trips to the emergency room. If you're a diabetic, if you have a chronic illness, if you take your medication, and ER visits are really carbon intensive. So it's better for the environment if we invest in primary care and we invest in ourselves.
Wait, how is an ER visit carbon intensive?
If you just think of all the testing that is, all the power that's used in ER visits.
Yeah, that's the last place you want to go. It's also the most expensive place.
It is,
I mean, and I
absolutely.
say last place if you don't really have an emergency. But if you have an emergency, that's probably where you want to go. Yeah.
Absolutely. But we want to try to keep you from getting there. And so a lot of those things, also help the environment. So like if you can walk more and take your car less, that's helpful for the environment, also for your own health. And then another thing I think that is important is the power that the private industry has. So corporate action really can move the needle a lot quicker than waiting sort of for government policy, which is also important. But big businesses can make changes in their supply chain and their power usage that really can move the needle for us.
Yeah, remember it wasn't so long ago at McDonald's and some of the other fast food chains. Remember they had the clamshells for the Big Mac and things like that,
Oh,
right?
yeah.
And then they went paper. I'm just saying examples of ways maybe that places start using recyclables. And if the big companies do that, that's the big deal. Because so many now, like for instance, we have a water bottle here, which I'm sure we probably provide you, but it says recycle me again on the side there. And that's what we plan to do with the plastic bottles that we get here if we can, and that's what we do at home. Try to recycle. But I just, the landfills just fill up. And big business. So I would just say, when I shop, I mean, I'm buying the product that's not wrapped in a zillion packages.
Sure.
The packaging these days is so over the top. There's ways you can do it with your bottom line dollar if you let them know. I don't know, is that how you send the message to big manufacturers? That you want them to be more green?
I think so. With social media and messaging, I mean, if you imagine if big companies and like Amazon, there's another big Oracle, if they got together and put pressure on to decarbonize the grid, right?
Right.
Big companies have a lot of power because of their economic power. I think that's important. I think also if we could, carbon labeling is a good idea. So if on products it said how much carbon this
wouldn't that
product
be interesting?
you
Yes.
could choose.
How will they measure that? Do you just determine? The different measures. Give me an example of maybe something that you would think could have a carbon product label on it.
So that also is outside of my wheelhouse, but I'll take a stab.
Well, I'm
Sure.
not saying specifics, but I mean, if you bought a candy bar, okay, let's say
Sure.
you buy a candy bar, and the label on there would talk about how much went into manufacturing that candy bar.
Sure.
So that's what the carbon footprint would be, okay? And it goes all the way back, if you're eating a Snickers, to the peanuts and where they came from, the water and the money spent to grow the peanuts, to the chocolate, to the packaging and all of that.
How it's transported, all of that, sure. So, or say at clothing, right? If clothing was labeled, if electronics were labeled, cell phones were labeled, so you could choose the product that has the lowest carbon footprint.
Okay, so for instance, whether you're buying a candy bar or an apple, the odds are the apple would have a lower carbon footprint. That's not to say that it doesn't have any at all, because that apple could have come from an orchard, it could have been sprayed, who knows. But the less processing, the less the footprint.
Yes, we would think so theoretically, yes.
Okay.
Yes.
That's actually an interesting way to think about it when you go shopping. And in general, the less processed the food, the better for you.
The better for you, absolutely. Absolutely.
Okay. Anything else, I guess, to talk to your lawmakers about it?
I think just really stressing the importance, I think stressing the connection that climate change has on health, human health, that really gets people, it makes it personal, it makes people want to move in.
I just wonder if people are beginning to get to that point where they're really realizing it now. You know, some people just say, oh, I like the hotter temperatures. I don't like it when it gets cold in the winter. But at what point do we start really thinking about, okay, some of these things we're dealing with are because of these temperatures, and it may not even be external. It could be the stress you're feeling because of it.
Sure.
Because you're walking in super. Look, when we had a string here, didn't you feel it for like, was it like 20 straight days of over 100 degrees?
Oh yes,
this
it was
summer?
devastating.
It was weird. All of a sudden, I started feeling, you know, just kind of not myself as much, and it was probably about 14 days in, and I realized it was because of the heat.
Sure, there is actually data that shows that as heat
or
increases,
90 degrees, yeah.
Yeah, that conflict increases, so there's more community violence. Because you know, if you imagine if you're in your
Tempers
car,
flare?
absolutely. When you're hot, your patience is less.
Yeah. See, so everything, climate affects absolutely everything.
It does. It absolutely.
And so that's where I just wonder if people, and again, getting back to the diseases as we just wrap things up, COVID, you think, had something specifically to do with climate?
I think they're still looking into that. I think most likely yes.
In terms of the spread of it, the beginning of it, we all know Wuhan, China, however that may have played out, what it came from specifically there. But the spread of it, what would you say is the climate component of, say, a pandemic like that?
I think it's hard. That's not really my area of expertise,
Okay.
I would say, but I do think, you know, one thing I know is for sure is as temperatures increase, that, you know, viruses can replicate much faster typically. I don't know specifically about COVID, but just the way it's all these things together, right? So it's climate is like a threat multiplier. If you just take Nashville, right? We had a tornado and all these people came right at the start of the pandemic, so I'm sure we had people bringing COVID into the city.
Yeah.
So it's sort of how climate functions to make all these threats sort of mixed together in this soup, like you said before.
Yeah, and that just kind of magnifies it.
It does.
You have one that's enough, and then you have something else on top of it. I'll never forget that. You know, the tornado, and then COVID, kaboom. It was shocking.
But you know what was great, though, I thought that came out of that, is if you all remember that how clear the air was when everything shut down. The shutdown, I know, was painful for a lot of people. But carbon emissions went way down. So we know we can do it. We know that we can do it. It's just the will.
I'm so glad you mentioned that. It's a perfect point to end on here. There was, in my opinion, almost nothing good about COVID, okay? There were some good things. We discovered, of course, that people can work from home. We discovered also that we can come up with vaccines and things quickly, as well as, you know, dealing with things medically to prepare for futures. And she is right, I mean, about how things shut down in some areas and how, like, wildlife returned to certain parts of the ocean because all of a sudden the shipping lanes stopped and the pollutants stopped. And it's amazing how quickly the planet can rebuild itself. Of course, now we're back to normal, making it into a dumping ground again. But during COVID, there were some amazing things that bounced back because people weren't traveling, we weren't going places, and that was awful, you know, the limits. But boy, that was a lesson right there. Listen, I really appreciate you coming on, Carol. Thank you for
so
this.
much
It's
for
worth talking
having
about.
me.
Listen, let us know. Keep in touch. I've got your number. I want to know when the heat study comes out. We'll probably
Absolutely.
hear about from the mayor's office as well. But definitely worth talking about. Thanks for coming on.
Thank you so much for having me.
Thank you. We'll take a break. I'll be back with a programming note right after this. Stay with us.